Well, the Washington Post calls it a landmark vote today on health care reform. Not since President Teddy Roosevelt proposed universal health care during his 1912 campaign has any such bill ever come this far. We're talking about the Senate Finance Committee today. 13 Democrats, 10 Republicans. Chairman Baucus says he has the votes to pass his committee's version of the bill today. We'll watch it all play out live here on C-SPAN this morning, and there's still a long way to go on this legislation. But we'll spend the first half hour talking about the Senate Finance Committee's meeting today and vote, we think, on health care. Republicans can call 202-737-0001. Democrats, 737-0002. And Independents, 202-628-0205. And before we get to your calls, we'll get started right away with one of the reporters following this issue. He is Robert Schroeder, reporter for Market Watch. And Mr. Schroeder, set the stage for us today. Exactly what is the structure for today's meeting of the Senate Finance Committee?
Well, sure. We get started at about 10 o'clock, and Senator Baucus will gavel the meeting to order. They broke last week with the intention of getting back to it today, and you'll see statements, I think, probably from all the members. I think they're all going to want to say something with something as big as they have before them coming up. And the chairman, Chairman Baucus, will probably want to hasten a vote as quickly as he can. He's been working on this for months and months and months, and he believes he's got the number, the magic number. He needs at least 12 votes to pass it on the 23-member committee. So he'll probably want to get going as soon as he can.
The New York Times reports that the committee will let senators quiz the director of the Congressional Budget Office and the chief of staff of the Joint Committee on Taxation. What kind of questions might they get, and what does it all mean to the final vote here?
Well, Republicans and many Democrats, of course, have been concerned about the overall price tag of this legislation. President Obama wanted something that came in under $900 billion in 10 years. And the CBO recently came out and said this will be $829 billion. That still may be too rich for some people's blood. So Republicans, mostly, I imagine, are going to want to question the CBO and the Joint Tax Committee about exactly how this bill saves money and from where. They're going to want to know the real nitty-gritty details, and they'll probably ask if it can be whittled down even further, because they argue, of course, that in the midst of a recession, even though the signs are looking good, this bill spends too much and still leaves about 25 million people without insurance.
Mr. Schroeder, yet another photo in the paper today of Senator Olympia Snowe, this one in the Washington Times, of course a Maine Republican. Remind us of why she is important, so important at this point, and what might be going through her mind.
Right. Well, Senator Snowe is thought to be the only Republican with a chance of voting for this bill. She was one of the quote-unquote gang of six that met a few months ago with Senator Baucus and 5 other bipartisan senators on the committee. She's going to be watching this very closely today, and everyone's going to be watching her equally closely to see if she'll in fact say yay or nay on this. She's considered a moderate, someone who's been willing to work with Democrats, and someone who's been sort of a good faith partner with Baucus all along. One interesting thing that may come out of her statement is what she thinks of a so-called trigger for the public option insurance plan later on down the road. This is something that came up during the committee's deliberations. The public plan writ large got shot down, but she at one point had talked about using it in an emergency case for people who couldn't afford insurance otherwise. So she's kind of keeping that in her pocket, and I think liberals on the committee and elsewhere are waiting to see if she wants to still bring that up.
And here's another big one, Mr. Schroeder, in the papers today, something that started bubbling yesterday morning. A couple of different headlines on this insurer story. Wall Street Journal, insurers push back as Senate health vote nears. And if you look at the Financial Times, they call it a fight on health care reform, and their lead says that the White House and the health insurance industry yesterday descended into open conflict on the eve of the critical Senate vote that could determine the fortunes of the president's health care reform plans. What exactly happened yesterday with this 26-page report that came out? Who put it out and why, and what's the reaction been?
Yeah, well, that's all exactly right. The report was released by America's Health Insurance Plans, which is industry trade group. The report was prepared by PricewaterhouseCoopers. And basically it said that a family policy that costs about a little bit more than $12,000 today would jump up to almost $26,000 on average by 2019. So the costs would go up much more than the White House is saying. The White House, of course, and Democrats saying, no, our reforms will bring costs down. And so yes, the Democrats in the White House really, really pushed back, saying that it didn't take into account, other provisions of the bill, like tax credits and so on. So characterizing it as I think open warfare, you said, is dead on. It came right, as you mentioned, at the beginning, or rather, one day before, of course, this critical vote. And what the result will be, I'm not exactly sure. Jay Rockefeller, who had some reservations about this committee's bill, and was worrying some who want to pass it with his criticisms of it, came out and said, no, this report is misleading and harmful. It represents corporate gain for politicking and so on. So it may not have had the desired effect or rather the effect that the insurance industry wanted it to have, because the questions are not out there, at least among the Democrats that were considered to be wavering.
Robert Schroeder, reporter for Market Watch, thanks for the setup today. Appreciate it.
Thank you.
Live 10 a.m. here on C-SPAN. We'll get started. We'll have the afternoon part of the session on C-SPAN 3. And before we get to calls, a reaction to this report from Senator Rockefeller. Again, the report is 26 pages, came out by Price Waterhouse, done by those folks, and released yesterday by America's Health Insurance Plans, AHIP. You can read the report at our website, cspan.org. And Jay Rockefeller, senior Democrat on finance, said the report was, quote, misleading and harmful and represented, quote, politicking for corporate gain at its worst.